Wow. Oh my god. It's so amazing. I want to cry. Before you watch this video, remember, plastic surgery is not for everybody. So if you're against it, stop. Because you're going to disagree with a lot of things you're about to hear or see. But if you want to know about the good and the bad side, how it affects my breathing, my sleep, and my life, let's keep going. 6 months ago, I got a rhinoplasty and lower blepharoplasty done in Beverly Hills, California.
So excited for you.
I'm excited too. I posted 2 surgery vlogs here on YouTube, but since then, I got tons of DMs and questions regarding my experience. So I decided to put a poll on YouTube to see what kind of video people want to see next, and the results were conclusive. But while the majority of people want to see the 6-month post-op update, I decided to include a Q&A section with Dr. Yoo as well. Not only that, I will also show you how close the Dr. Morph is to my 6-month post-op nose. But first, hi, my name is Magdalenna. I'm from Indonesia, and this is how I look like before the lower blepharoplasty and the rhinoplasty. The nose that you saw on my first vlog was the video thread nose. Even though I love the video thread result so much, that thing was going wrong and they needed to be removed. Oh no! As for the ibex, they're genetic. I've had them since I was a teenager, right here. The goal of my plastic surgery is to improve the look of my ibex, more projected nose, maybe like Tinkerbell. And I think I got it. So today is 6.5 week post-op, I think. A lot of people have been concerned about like, is there asymmetry on my nose? To begin with, I'm not a very symmetrical person. And like if you see my smile, this one is like bigger and then the other one is like smaller. If you see, actually Dr. Yoo made it more symmetrical. It's actually straight and he aligned it with this thing and with my brows. But then when I'm making facial expression, you know, you would see some asymmetrical because I'm just not a very symmetrical person. However, that wasn't the only thing people were concerned about. On my previous video, they were most concerned about the upturned tip. They said that my nose looked biggish and I look butch, and for that reason, I kind of stopped recording for a couple of weeks, ignoring the fact that Dr. Yoo said the tip is going to drop and the fact that I love the result so much. I had let everything go into my head and felt like there's no point of making another update anymore. Until, at 4 months post-op, I looked back into my gallery and realized that tip has dropped so much. And of course, Dr. Yoo was right. Even my smile is kind of back to normal. People that called me piggish and weird before had apologized to me and said,
"No, it looks a lot better now. You look better than you ever did before."
Really? What did you think before when I was like swollen and stuff? 6
That you
weeks.
spent money to get a worse nose.
That was then. Now I'm back to my usual confident self. Back to me, the host of this nose job update, you guys. Now if you see me having like a big nose from this camera, that's because it's a wide angle. That is normal. The eye back is actually what makes me think, why haven't I done this sooner? Because it makes me look so much younger, makes me look so awake. And by the way, for people who ask me why am I doing this video, I'm simply just someone who wants to share my experience to girls or boys out there who's considering plastic surgery in general. It is very important to me at the time when I do research about plastic surgery, so I think it's important for me to share what I've learned, how my experience is. So here I am. And that brings us to the Q&A session. But I know there's a lot of questions I couldn't answer myself. So why don't we go to Beverly Hills, get a 6-month post-op checkup, and ask Dr. Yoo some of the most frequently asked questions. So we're taking pictures again with Karina. I can't wait to see Dr. Yoo because I haven't seen him for a while, so I'm excited for him to see my progress. So let's start with the thing that people most concerned about, scarring. For lower blepharoplasty, there's no scar at all because the incision was made inside your eyelid. But for the rhinoplasty, there will be 3 scars. The 3 cm scars on your scalp where they harvested your fascia, the 1 to 2 cm scar under your breast where they harvested your rib, and the nose incision scar where they put the fascia and the rib graft inside your nose. But don't worry, all these scars are very unnoticeable and minimum.
Good. So here's the fascia scar.
Yeah. See.
You can see that faint line right here, but you can see that your hair is growing through it. So unless you shave your head, it should be really hard to see.
Yeah.
So a little bit of discoloration, but you can see it's nice and flat. Just avoid too much sun exposure until the color fades, and then if you are in the sun, just use sunscreen.
Okay,
Yeah.
right there. Is there any way that discoloration could disappear?
Time will be the biggest thing, and then if you want to be very aggressive, we can try hydroquinone.
Oh,
Bleaching
that's the
cream?
bleaching, yeah.
Yeah, the only thing with that is that it can sensitize your skin so that if you get sun exposure, it turns darker. But I think at that color, we should just give it a little bit more time.
Okay, yeah.
Give me a smile. Okay, good. Beautiful. Okay, good. This scar is healing nicely. Are you still doing scar gel?
Yeah.
So I would just continue that until it runs out. And then same thing here, you want to protect it from sun exposure.
Yeah.
And your airway looks good. It's nice and clean.
Yes, talking about airways, my breathing has actually been amazing. I couldn't tell you how great it is to have a bigger airways to your system. Before, my nose was very flat. Sometimes when I'm anxious, I will feel like unwell. It's just because there's not enough oxygen going to your brain, not enough oxygen for your body to really function well. So since the rhinoplasty, I feel like there's more airways. I don't snore anymore. Or at least I don't think I do. How do I blow my nose? I use Q-tip most of the time to clean the inside of my nose, like booger stuff. But for the mucus itself, you just blow your nose normally. When I try to clean my nose with a Q-tip, sometimes I rub too hard and feel some kind of itch. So I voiced my concern to Dr. Yoo.
Towards the middle. So there's no stitch, but you can feel the edge of the rib cartilage towards the top here. So the stitches are completely gone, but if you rub your Q-tip along the inside of the septum, which is in the middle, you can feel the edge of the rib cartilage.
Okay.
That's on the side of the septum supporting your tip.
Oh, that's what it is, yeah.
Normal.
So that feeling is completely normal. Could you guess what else is normal? For the tip to look super upturned the first couple of weeks or months, because trust the process, the tip is going to drop. I know some people was concerned about how I'm gonna look piggish if I have the Tinkerbell tip, but no, you wouldn't. Nobody had said that to me after 6 months post-op. They see me in person and they just like, wow, it's amazing. As you can see right now, you see my face. It has changed since the last time I posted a video. Before, there was some stiffness on the upper lip, and that's the reason why. But for now, I think my smile almost 80%, 90% back. But different patients have different experience during the healing process. It all depends on so many factors, including the thickness of your skin. So what kind of skin type do I have?
It's on the thicker side.
Thicker? Okay. So if you have thicker skin or very thick skin, that means you will have a way longer time to de-swell. For Asian, African, Indian included, for our skin, the swelling really take a year or 2 years sometimes to really de-swell. Some people ask, did I get a steroid injection? No, I didn't, because Dr. Yoo said I don't actually need it. The steroid injection is for your nose de-swell faster. In my case, I don't need it, maybe because I'm only on the thicker side, so then I'm already de-swelling at the normal rate. So at 6 months post-op, I wonder, is this my final result? Am I going to de-swell more? Let's ask Dr. Yoo himself.
And then for your nose, it's about 80% healed right now. So you can
Okay.
expect that it will still get a little bit more defined and slimmer. The tip will settle down a little bit more, and you'll get more definition along the tip. So the nose overall will get a little bit smaller. So at 1 year, it will be about 95% healed. So almost fully.
That's good to know. And how about like the smile? Because
The smile will also be continuing to improve as the swelling goes away. But even when it's fully healed, you'll feel more resistance when you smile a big smile. Because as your lip comes up, it's going to touch that support with your nose. The biggest precautions going forward, number 1, sun exposure like we talked about. Number 2, for the rest of your life, you have to be gentle with the tip of your nose.
Okay, lastly, the most important question. Do I look like the morph he showed me on the pre-op? It's my dream nose. Did you know? Yeah. So weird. Oh my god, it looks so good. I look that good from this side? It's crazy. Wow. Oh my god, it's so amazing. I wanna cry. Wow. I feel like I've stated it so many times that the results mean so much to me in so many ways. Not only just the look of it, but also the function and the psychological side of it. People think that I look super different on camera, you know, the before and after. But in real life, people just notice me as a prettier version of me, they just think like, oh man, you look good these days. What happened? I was like, did you work out? It's like, no, I didn't work out. I just got a nose job. I got a lower blepharoplasty. So that brings us to the end of the video. I'm very happy that some people reach out to me. I'm very happy that some people actually love the results, and I'm also happy. I really appreciate people that don't love the results and being polite about it. Anyway, I'll see you next time. Dr. Yoo looks good. Oh, by the way, Dr. Yoo, do you see the comment about calling you? Oh my gosh, Dr. Yoo is so hot.
No, I didn't.
You need to see the comments on the video.
so
Oh my
shy.
god. Do you have comments to that? Oh my god.
Do I have a comment to that?
Yeah.
I'm happily married.
That's a good question.